Welcome. Today we're diving into a really practical guide on using Tepezza for thyroid eye disease. This is specifically for you endocrinologists out there. We're going to cover the real-world stuff, the how-tos, from dosing all the way to patient counseling, so you can feel confident using this therapy in your practice. So let's jump right in.
Okay, here's our game plan. We've got 5 main stops. First up, the basics, what it is and how it works. Then we'll get into the nitty-gritty of dosing and administration. After that, we'll cover the super important safety and monitoring piece. Then we'll look at the data. Does it actually work? And finally, we'll wrap up with the essential patient counseling points. Pretty straightforward, right?
All right, Section 1, the indication and mechanism. So let's start at the beginning. What exactly is Tepezza, and what's it doing to help with thyroid eye disease? So, at its core, Tepezza is what we call an IGF-1R inhibitor. That's a mouthful, I know. Basically, it's a monoclonal antibody that targets the insulin-like growth factor 1 receptor. Think of this receptor as a switch that, in thyroid eye disease, is stuck in the on position, driving all that inflammation and tissue growth behind the eyes. Tepezza comes in, binds to that receptor, and just flips the switch off. It blocks that whole signaling pathway. And that's really the key to how it works.
All right, so that's the science. Now let's get practical. Section 2 is all about dosing and administration. This is the real how-to part, the stuff you'll be doing day in and day out when you're treating patients.
Okay, so the full treatment course is a series of 8 infusions. It's pretty straightforward. You start with one initial infusion at 10 milligrams per kilogram, kind of like a loading dose. After that, you've got 7 more infusions, but you double the dose to 20 milligrams per kilogram for those. And those happen every 3 weeks. So, one starter dose, then 7 more at a higher dose every 3 weeks. Simple as that.
Now, the prep work for the infusion really does require some attention to detail. First, obviously, you calculate the dose based on the patient's weight to figure out how many vials you need. Then, you reconstitute each vial. Now, this is a super important point. You need to gently swirl it. Do not shake it. You don't want to mess with the protein. Once that's done, you'll dilute it in a saline bag and mix it again with just a gentle inversion. And of course, the whole time you're using aseptic technique. That goes without saying.
So how long is the patient actually sitting there for the infusion? Well, for the first 2 infusions, you're going to run it over 90 minutes. This is really just a safety check, right? You're watching to make sure everything's well tolerated. If those first 2 go off without a hitch, you can actually speed things up for the rest of the infusions and run them over 60 minutes.
Okay, we've got the how-to of giving the drug down. Let's move on to something just as critical. Section 3, monitoring and safety protocols. This is all about what to watch for and how to keep your patients safe while they're on treatment.
First up, infusion reactions. Now, these aren't super common. We're talking about 4% of patients, but you absolutely need to know what to look for. We're talking signs like a sudden jump in blood pressure, the patient feeling hot, tachycardia, maybe some shortness of breath. So what do you do if you see this? Simple. Slow down or just stop the infusion. And for that patient's next infusion, you'll definitely want to consider pre-medicating with something like corticosteroids or an antihistamine.
Okay, here's a big one to keep on your radar, inflammatory bowel disease, or IBD. Tepezza can actually cause a flare-up. And here's the really important part. This can happen even in patients who have no prior history of IBD. That's why you have to monitor everyone for symptoms like diarrhea, blood in the stool, or abdominal pain. And the guidance here is crystal clear. If you suspect an IBD exacerbation, you discontinue the drug.
Now, for this audience, for you endocrinologists, this one is right in your wheelhouse. Hyperglycemia. This was seen in about 10% of patients. And get this, of those who developed hyperglycemia, most of them already had diabetes. So the takeaway is pretty clear. You've got to check blood glucose before the first infusion and keep a close eye on it throughout the whole treatment course. And for your patients who already have diabetes, it's absolutely crucial to make sure their glycemic control is as good as it can be before you even start them on Tepezza.
All right, another major precaution, and this one is serious. Hearing impairment. About 10% of patients experience this, and it's not always just a minor thing. It can be severe, and in some cases, it can be permanent. So, the monitoring protocol here is a non-negotiable. You have to assess the patient's hearing before they start, during the treatment course, and after they finish. This makes the benefit-risk conversation with your patient incredibly important. They need to understand this is a potential outcome.
So if we look at the most common side effects from the trials, the big one you'll see is muscle spasms. A full 25% of patients on Tepezza reported this, compared to just 7% on placebo. After that, you've got things like nausea, some hair loss, diarrhea, and fatigue. You can see they're all more common than with placebo, but the key here is that they're generally manageable. It's really about setting the right expectations with your patient from the start.
Okay, so we've just talked a lot about safety and monitoring, which naturally leads to the question, what's the payoff? Why go through all this? Well, that brings us to Section 4, the clinical trial data. Let's see how well this drug actually works.
So in the big clinical trials, the main thing they were looking for was the proptosis responder rate. In simple terms, they were counting how many patients had at least a 2 mm reduction in that classic eye bulging by week 24. And honestly, the results are pretty staggering. In the first study, you see 71% of Tepezza patients hitting that mark, compared to just 20% on placebo. But look at study 2. The gap is even bigger. 83% of patients responded versus only 10% in the placebo group. I mean, those are some dramatic numbers.
Let's just zero in on that number from study 2 for a second. 83%. That means more than 8 out of 10 patients saw a significant reduction in their proptosis. When you compare that to the 10% on placebo, that's a whopping 73-point difference. It just goes to show what a powerful impact this drug can have on what is really the most visible and distressing sign of thyroid eye disease.
And this chart really drives the point home. It's showing the average change from baseline. For the placebo group, you see a tiny improvement, about 0.5 mm. But for the Tepezza group, we're talking an average reduction of 2.8 mm. So it's not just that more patients respond. The magnitude of that response, how much better they get, is significantly greater. It's a huge difference.
Okay, we're on the home stretch. We've covered the science, the how-to, the safety, and the data. So now, for our final section, number 5, essential patient counseling. This is all about bringing everything together and making sure your patient is a true partner in their own treatment. Okay, this is probably the single most important counseling point you will make. If you remember one thing from this section, make it this. Because of the potential for harm to a fetus, Tepezza is a no-go during pregnancy. So for any female patient of reproductive potential, you have to be absolutely clear. They need to be on effective contraception before they even start for the entire duration of treatment, and, this is key, for a full 6 months after their last dose. This is non-negotiable.
And of course, you'll need to run through the other key warnings we've already discussed. You have to arm your patients with knowledge. Make sure they know what an infusion reaction feels like. Tell them if you have any new diarrhea, bad stomach pain, or see any blood, you call us immediately. You've got to stress the importance of them monitoring their blood sugar. And finally, make it crystal clear. Any change in your hearing, tinnitus, feeling like your ears are plugged, anything, you need to let us know right away.
And that really wraps up our clinical guide. So we've walked through the whole profile of this drug, how it works, how to give it, what to watch for, and how effective it can be. So the last thing to do is really turn the question over to you. Start thinking about your own practice. Based on everything we've just covered, who are the patients you see with thyroid eye disease that might be good candidates for Tepezza?
And just one final practical note before we sign off. If you do encounter any suspected adverse reactions, here are the official contacts for reporting them, both to the company and to the FDA. Thanks so much for tuning in.